Hello, this is Mr. Sater again. I have not posted a video in quite a long time, but my students are doing the eye right now, so I thought I'd throw this out for you. I'm going to ask you to do both the name, so I'll show you the arrow, I'll pause, and you state the name. Then I'll pause again, and you tell me the function or some of the properties of the structure. And listen, your class may have different requirements than my class, so I am just going over some of the basics that are appropriate for my students' level, so I hope you get some use out of this. Let's go ahead and get started. Before we begin, the structures I'm going to talk about, like when the arrow points to something, it's where the very pointy tip of the arrow is, so that's what I'm referring to. So what's the name of the white structure that the tip of the arrow is in? All right, that's the sclera. So the white of your eye is the sclera. All right, functionally, it's just tough connective tissue that gives the eye its shape and a little bit of protection. All right, let's move on to that next layer, the sort of reddish one step in. What's the name of that? All right, that's the choroid, and functionally, tell me a little bit about the functions before I tell you. All right, that's what all the eye's blood vessels are made up of, and the nerve tissue uses a lot of energy, so it has to have a really good vascularization. Eye doctors can look at these blood vessels and tell a little bit about your health. If you have high blood pressure, if you have diabetes, there'll be you'll grow new blood vessels in your eye. So it's a nice way for people to get some medical checks while they're getting an eye exam. We can sort of tell things about you. So maybe diabetes could be diagnosed during an eye exam. All right, our next one. I'd like to know the name of that entire yellow layer, not just where the arrow is, but the whole thing. It wraps around, kind of makes a letter C toward the front of the eye. All right, that is your retina. You have more nerve endings in your eye than anywhere else in your body. Almost 70% of your sensory information comes in through your eye. So the retina is covered in cones and rods. There are cones detect color vision, and I always remember that because color starts with C, cone starts with C, and rods connect low light vision, black and white vision. There's more rods in the peripheral vision than there are in the center. You see best in the middle with color, so you have more cones there than anywhere else. And of course, there's 3 types of cones. If you lack one or more of those, you'll have the different varieties of color blindness. All right, this next structure toward the front of the eye. Okay, you do the name. That's going to be called the ciliary body. All right, what's its function? All right, functionally, that's smooth, involuntary muscle that pulls on the lens, and it adjusts the shape of your lens depending on if you're looking at something nearby or far away. In a relaxed position, human vision is set to see things that are far away. So as we get older, the lens gets a little tougher and doesn't bend the way it used to, so we lose our near vision, and that's why you'll see people, as they start to age, they may either use reading glasses or they'll start holding things they want to read farther away from their eyes because their lenses aren't as flexible as they used to be, and they won't accommodate near vision as well as they do when we're young. All right, next. These are a little bit hard to see in this diagram, but they're kind of like little tiny threads that come out of the ciliary body. All right, this one can have 2 names. I've heard called the ciliary zonule, and the other one I've heard it called is the suspensory ligament. So these are just little ligaments that wrap 360 degrees all the way around the lens. A lot of students see this picture and they think that these structures are only on the top, but if you think of one of those backyard trampolines and the springs pulling on the trampoline, they wrap all the way around, and so do the ciliary body and suspensory ligaments. They do wrap all the way around and pull the lens from 360 degrees, not just the top and bottom. All right, right in the middle. I've been talking about it, so this should be an easy one. Okay, that of course is your lens. It's a clear crystalline protein that is flexible. It changes its shape to refract light and focus it on the back of your eye. If you wear glasses, for whatever reason, light doesn't go through your lens right, usually because your eye is not shaped properly, and glasses will correct that refraction and get that image focused as best we can. All right, this next one, the opening in the center, not the blue part. That, of course, is your pupil. Functionally, that's just the opening that allows certain different amounts of light to get in. As your pupil constricts, it gets smaller, so that would be in bright light. And if you were into dark light, your pupil would dilate, and you would be able to see a little bit more light. In a really basic neurology exam, you would want pupils to be equal, and you would want both pupils to react to light. So if that's not happening in a patient, there's definitely something not quite right there. So let's go on to the next one. This is the blue area. Okay, we talked about the pupil in the middle. All right, this is your iris, and it is also made of smooth muscle and can be different pigments. And the pupil is not really a thing. It's an opening. It's more of a space. But the iris is the smooth muscle curtain that kind of, if you know anything about photography, it's kind of like your aperture. It controls the amount of light that enters your eye. All right, this question has two parts. I want to know the name of that space, and I want to know the name of the fluid in it. Okay, the space is called the anterior chamber. And what's the fluid? All right, the fluid is called the aqueous humor. That's going to be your really watery fluid. It's going to give the cornea some shape. It's going to supply some nutrients for the eye, and mainly keep the cornea inflated to allow light to enter properly. All right, and I don't think I put cornea on this, so if we go just that sort of hump in front of the iris and lens, and the very, very tip, that little bump out on the front of the eye is your cornea. All right, let's move to the chamber, the main chamber of the eye. I want to know the name of it and the type of fluid that's in it. All right, well, this is pretty easy. It's a posterior chamber. It's bigger, and it has a fluid in it called, you tell me. All right, I'm looking for vitreous humor there. Now, functionally, that's just going to give the eye its shape. When your eye doesn't have a very good shape, light can't focus on the back of your eye properly, so we want to keep your eye inflated. We're checking the pressure of this when you go to the eye doctor and get that little puff of air in your eye. That deflects your eyeball in, and they measure that deflection, and it tells you if your eye pressure is within the normal range. All right, this is a spot in the back of the eye. What's the name of it? All right, that's your optic disc. There are no cones and rods there because we have to have space for the nerves and blood vessels to enter. That's where your blind spot is, so you won't be able to see anything that's focused on that spot. But our eyes together eliminate that blind spot, so if you want to do an activity where you check your blind spot, you're going to have to just use one eye. All right, our last one. This little divot here in the back of the eye. That's called the fovea, or the fovea centralis, and functionally, tell me about what's going on there. Functionally, that's where we have the sharpest, most vivid vision. There's more cone cells packed more tightly in that spot than any other spot. So that's sort of the main center of where our vision is and where we see best. All right. I hope you get some use out of this review of the eye. You can watch this as many times as you want. I hope I paused enough. I appreciate all the comments. They do help me plan how to make the next videos. So maybe I'll do one on the ear next if I can squeeze that in.